Perfect. Well, we're 1 minute past 3 and I can see people are joining us, but for time, and I know we've got much to talk about today, so I'm going to kick off with the introduction to our moderator for this session. So we're very blessed to have been partnered and joined by Senfree for these 3 webinars looking at the impact of COVID-19. And today's session is particularly focused on financial health. So I'm going to hand over to our moderator, one of the directors at Senfree, Henny Bester. Over to you, Henny.
Sarah, good afternoon. Thank you very much, and good morning to some people who are on the other part of the globe. It's a pleasure to join you this afternoon. This is part of our webinar series on the economic impact of the current pandemic, COVID-19, and how we can respond to that. And today we're looking at the financial health of populations. And as we discover, we probably need a slightly different measure right now than the financial health. We had our previous webinar was on remittances. Our next one will be on the gig economy. And the intention of this series is not to present any definitive answers, but really to put some basic data on the table and to explore what possible responses can be. And to assist us to do that today, we have a very capable panel. Elizabeth Ryan, Beth Ryan, is the former managing director of the Center for Financial Inclusion at Axion. And she has spent the past few months working with us at Insight to Impact, really to thoroughly review the measurement of financial health across the globe. And I can't think of anybody that's better placed than Beth to speak on this. Then joining us shortly also is Amolo Ngueno, who is the CEO of BFA Global. And they've done some very interesting rapid surveys on that in a number of countries that she'll share. And then coming all the way, I think, Paul, you're in the other side of Latin America, in Chile. Paul coming to us far away from here in the early morning, I would imagine. He's been with FSD Kenya for a number of years. He's their research advisor. And he's done some very incisive looks at the current impact of the crisis and the likely impact on financial health. So to kick us off, and we've got quite a lot to cover today, Beth will look at how financially prepared were adults around the world before the crisis hit. Beth, over to you. Welcome.
Thank you, Henny, and good morning, afternoon, evening to all of you. I'm really happy to be able to be here. And, you know, as Henny said, I've been working with I2I on this study of what's the state of practice on financial health. And it really turned out to be very timely as the COVID epidemic approached. But you'll be able to see the paper, which is really about what policymakers should be doing with financial health or can be doing with the financial health concept. And that will be up on the website pretty soon. But what I want to do is start with the next slide, which is how Henny posed the question, but I want to move to the next slide, which is how do we define financial health? What are we talking about when we talk about financial health? And I have here 3 definitions that were put forward by 3 of the researchers that have been the leaders in developing the concept of financial health. And I'll just read the last one, which is the simplest. Financial health comes about when your daily financial systems allow you to be resilient and pursue opportunities over time. So financial health is really about whether you're capable of and succeeding in, and whether your context allows that to happen in the management of your financial resources. We can think of financial health as having 4 elements, and usually these 4 elements are what's measured when you measure financial health. Smooth day-to-day finances, being able to meet financial obligations on a day-to-day basis. Second is resilience, or ability to recover from financial shocks. And the third is being able to pursue your longer term goals. And then the fourth one, which is not always included in all the definitions, is that you have confidence and a feeling of control about your finances. So clearly, all of financial health is important, but in this context, we're going to just focus in on the question of preparedness to meet and recover from shocks. Next slide. So it turns out that this question of resilience is the only one that's really been measured globally, and it's been measured by the World Bank's Global Findex, both in 2014 and in 2017. And they asked the question, which I call the resilience question, which is, if you were to need to raise a lump sum of a certain amount in an emergency, would you be able to do so within the next month? Would it be hard? Would it be very hard? Would you be unable to do it completely? Would it be easy or moderately? Anyway, it's a 5-point scale, which I messed up in the way I described it, but you get the point. And the responses, as you can see from this map, they vary dramatically across the globe. One thing I want to point out is that even within the group of higher income countries, there's a significant amount of variance. You see Scandinavia, where nearly everybody is able to have this kind of a resilience at their disposal. But when you move then to the United States and to the UK, it drops off considerably, when the United States about between a quarter and a fifth of people really can't come up with the amount. And then it goes from there, and clearly Africa is the place where the resilience is lowest, with people having very, very little in terms of ability to deal with shocks, and they actually experience shocks quite often. I also want to point out that Latin America doesn't look so good. Move to the next slide, which looks a little bit more at the regions. So in these, I think I want to just make 2 points about this slide, which shows you each circle represents a country, and it shows their average score on this resilience question. So you see clearly, as in the previous map, that Sub-Saharan Africa has the lowest scores, but look how wide the variation is. So countries have been able to help their citizens, or perhaps there are other explanatory factors that there's a wide range. I also want to point out Latin America as the region that is second lowest, and this is surprising because it isn't the second lowest income region, but it has some particular problems with financial preparedness, I think, owing to its history of high inflation and suspicion of the financial sector. Let's go to the next slide. So let's zero in on Africa, and you see that there's a huge proportion of the population who can't come up with these amounts, and these amounts are really, when you scale them for GNI, they're moderate amounts. They're in the range of $100 to $200. So if half the population of a country cannot come up with, well, actually the range is a bit bigger, it's 50 to almost 300. But if half the population cannot come up with this amount of money in an emergency, you know that people are really living on the edge. So moving to the next slide, we have a question that is a slightly more pointed question in this situation. So in this situation, although some people are being asked due to health emergencies to come up with a lump sum, and certainly for funerals, they'd be asked to come up with a lump sum. a much higher percentage of people are probably going to have disruptions in their income. And so this is really, you can think of this as, let's think of this as a timeline for what's happening in the epidemic. And at the point 0, we're starting to do social distancing, isolation, whatever you want to call these measures that are locking down and slowing the economy. So at that point, people still have all of their reserves intact. And the question that's being asked in this graph is, how long can you cover your basic needs if your income stops? And so what we see is, first, there's a different trajectory for the higher income and lower income countries. But you also see that fairly quickly, a big portion of the population is in trouble. So if we can say that we're 4 weeks into the social distancing, I know I'm 4 weeks into it. Some of the countries in Africa have maybe started a little bit later than Virginia in the United States. But by this time, we've already seen a huge fall off because there are so many people who answer that question in terms of a week or 2 weeks of cushion, that financial cushion that they have. So then if we want to think about the time, how long is this lockdown going to last? And we see, oh, maybe 3 months. By 3 months, there are only about a quarter of the people in the lower income countries who still have enough assets to be able to cover their income. And by the time it's really played itself out, and we hope it's played itself out fully by 5 months, really nearly everyone in the lower income countries is going to need is going to have fully depleted themselves in terms of their financial reserves and their ability to obtain the resources they need to cover their expenses. And we'll look a little bit more at how they go about covering their expenses, and we'll see that their options for doing so also dry up during this period. But we also note that even in the developed world, about half of the people are in deep trouble by 5 months. So this is, to me, clearly one of the big messages is, hey, why were we as a world, so unprepared in terms of helping people to have the kind of cushion that they would need to be able to go without income or to have income drop off for a period. But we can explore more of the reasons why and how people can respond in the next slides. But I'm turning it back to you, Henny.
Thanks, Beth. Beth, before we let you go, just one question that intrigues me about this slide. You know, the question was, for how long would adults be able to cover all basic needs using savings or asset sales? And if you consider a lockdown situation, and also what's interesting to me here is that I would assume the respondents' assumption as they answered the question was that the rest of the economy around them would proceed. But if you assume that everybody is in the same boat and that markets to realize assets would be compromised under the lockdown, I mean, wouldn't this probably be a significantly more optimistic picture than the reality under lockdown?
Yeah, absolutely. This is in a systemic, when it's a systemic crisis, and we'll show this in more detail, but when it's a systemic crisis, some of the main coping mechanisms don't work. So yes, one of the main coping mechanisms is working more. And so that's an option that's not available. Selling things may not be available because nobody wants to buy anything. And relying on family and friends is not as good a coping mechanism as it would be if your problem was more idiosyncratic than systemic.
Exactly, exactly. Thanks, Beth. We'll come back to some of this a bit later. Now, Amolo must be having technical difficulties. She's not been able to join us yet. So, Paul, we're going to skip on to you. And Sarah, if you could go to slide number 14, which has the heading, The Deep Dive, COVID-19 and Financial Health in Kenya. Then, Paul, we're going to ask you to take over from here and just give us a sense of what you've analyzed from this data that you've looked at. Paul, are you there? Yep.
I'm here. I got disconnected, but I'm back, so hopefully we'll stay that way.
Fantastic. You're back. Yeah.
Yeah. Can you hear me?
Yes, we can.
Yeah.
Thank you.
So I'm looking at a version of the presentation on my screen on the introductory page, but I assume my section, you'd like me to go through my section now, right?
Yes, please. So Sarah,
Okay.
if we could go to slide 15, the next one, please.
Sure. Yeah, I guess let me, that was a very nice overview of the landscape, Beth. And I just want to start by saying, and this you'll see hopefully when Amolo presents their more real-time data based on the phone surveys that they've done in the past week or so. But I wanted to start by saying that Kenya is likely to be hit exceptionally hard by this pandemic. There was just a study by McKinsey that estimated that in a kind of a worst case scenario, if the virus isn't contained, the GDP growth rate could fall from about 5.2% to negative 5%, so a contraction of the economy. That's sort of I guess, of a worst case scenario. But in Amolo's slides, you'll see that already, and Kenya seems to be an outlier here, people are citing significant drops in income. And so that's compounded on top of an already very difficult financial situation for many Kenyans. In the Gallup survey that Beth was referencing in the last slide, close to 3 in 4 adults in Kenya reported that it was difficult or very difficult to get by on present household income. And so that's in normal circumstances. And I would also just like to say that Kenya has been acted pretty quickly and decisively in response to the very first detected cases, already introducing a series of social distancing policies and economic measures. So I think that response is promising, but there's no sugarcoating this. I think this is going to be a big shock to Kenya and to the region. So before I dive into this slide, I just also wanted to, one way to think about the role of financial health is as kind of a mediating factor that will determine the degree to which the income shocks that people will face, either through deliberate policies, social distancing policies, or as people's preferences shift. The degree of financial health people have will determine how far their material living standards will fall, and that will depend on how affected people's systems for smoothing their consumption and dealing with shocks is. So what this slide is showing, it's showing the results to a follow-up question in the Global Findex that asks people who say that they would be able to raise that lump sum of 1/20 of GNI. Among the people who say yes, they can raise that money, how they would do so. And the response options there were some financial kind of coping strategies, either drawing on personal savings or borrowing from a bank or an employer or a private lender. And the other response options were non-financial. So getting support from your friends, your family, relatives, in other words, your social network, working, and selling assets. And in Kenya, you see that about, a a large majority, about 2 in 3 adults, would use these non-financial strategies to raise money, and about a little over 1 in 4 would use their savings, and about 1 in 10 would use would borrow. And what distinguishes Kenya from its lower middle income peers and its regional peers in sub-Saharan Africa is a slightly higher share of adults who could use financial strategies. So that's, I think, a positive note for Kenya and speaks a little bit to its success in expanding access to financial services, is that a relatively larger share of people in Kenya will be able to use, or in normal circumstances can use financial strategies. Now, the problem in this situation is, you look at the coping mechanisms that people have in normal circumstances, say working. Yeah, okay, so if I need to raise $75 in the next month, I can count on working and raising that money in the next few weeks. That likely is not going to be an option for many, especially if the country continues to implement strict social distancing measures. The same with the social network. Transfers from friends and families. If everyone is facing an income shock or loss of jobs, it's going to be harder to draw on your social network for support. And again, Henny touched on this previously, also selling assets. If that might not be so easy in this context as well. So really, in Kenya, about 52% of adults said they could raise emergency money in about a month in normal circumstances. In this circumstance, there's we're talking about a much larger share of adults, possibly around 70 to 80%, who will be vulnerable and not really be able to cope as effectively as they would in normal times with an income shock. So we can go to the next slide. So the degree to which the pandemic is gonna affect people's standard of living will also depend in part on which livelihoods and sectors of the economy are hit hardest. So here is the breakdown of a question we ask in the FinAccess survey, which is a nationally representative survey conducted by the Central Bank of Kenya, the Kenya National Bureau of Statistics, and FSD Kenya, about the primary source of people's income for different income groups. So the poorest 40%, the middle 40%, and the richest 20%. And what I think this chart helps us appreciate is just how informal Kenya's economy is from an employment standpoint, and the potential disconnect between economic relief implemented through the tax system and the employment reality of most Kenyans. And it also helps us think about potentially a differentiated response for different livelihood groups. So for example, policies that support people formerly employed in companies that may be facing looming layoffs are likely to look different from policies to support casual workers. So just the point I want to stress here is that for the most vulnerable Kenyans living on the lowest incomes, the dominant majority depend on casual work, farming, or transfers being pensions, support from family and friends, or money from the government or an NGO. Whereas in the richest 20% of the population, about half earn their money primarily through employment or running a business. So I think this is another way of appreciating, the vulnerability of Kenyan livelihoods, which are really concentrated in casual work, farming, and self-employment, and transfers as well. So people depending on their network, on remittances, and on government programs.
Paul, Paul, before we go on, I mean, just one interesting thing of this graph, is it not a case of the current situation that normally we would look at people in rural areas as perhaps particularly disadvantaged, but that the the farming ban here may, if this carries on for a significant time, actually be in a better position than the richest 20% in employment and own business, if those incomes aren't able to materialize, but at least in rural areas, people have some sustenance in kind in the form of farming produce and stores. Could that not be one of the ironic outcomes of the current situation?
Yeah, no, I think you're absolutely correct. I think it's hard to predict exactly how the economic impacts of this epidemic in Kenya will play out, but I think my intuition is that you're right. People in rural areas will have the option of continuing to farm, at least in the short term, as long as they're able to secure farming inputs and potentially hire labor for, to collect crops. And so at least they'll have some, and they can consume any crops they're able to produce, even if they're not able to sell them on the market to some degree. So I think you're right. I think as a first order impact, I think is going to hit these more vulnerable groups in towns and cities who, these are people in sort of lower skill service sector employment that are they're going to see the impact the hardest in the near term.
Thank you. Yeah.
So the casual workers and people running small and micro businesses. So I think we can go to the next slide. So this slide is showing two sub-indicators of FSD Kenya's own financial health index, which relate to financial resilience. The first indicator is the percentage of adults who can access a lump sum in the event of an emergency in 3 days. So this is more strict than the Findex question, which gives people a month to raise that lump sum. In this case, the lump sum is about 50 USD for rural people living in rural areas, and about 85 USD for people living in urban areas. And the second indicator, the chart on the right-hand side, is just showing the percentage of adults who regularly set money aside for emergencies. So it's sort of this behavioral, gives us a sense of how common it is for people to have this behavioral habit of keeping some money aside in the case of emergency. And the 2 points I want to highlight here is that on average, people are more likely to say they set aside money for emergencies than they say they are able to raise a lump sum quickly, which suggests that the emergency reserves that people do have is relatively small and best suited for minor day-to-day shocks. And the second point is that financial resilience, proxied by both of these indicators, is strongly associated with income, and I think that's intuitive, but it's also strongly correlated with livelihoods. And in general, people who depend on casual work or transfers are the most vulnerable, even across income groups, while people who depend on employment and their own business are the least vulnerable or the most resilient across income groups. There is an exception there with the richest 20% of farmers that seem the best able to raise this quick lump sum in an emergency. And that just might be, these are perhaps larger scale farmers with connection to export markets. Maybe they can get financing and support from buyers relatively easily. So there's some interesting patterns here to dig into, but in general, what we see here is that casual workers and people who depend on transfers are the segments of the population who are the least prepared for a shock like this one. I think we can move on to the next slide. I don't want to spend too much time on this, and this relates to the comment that Henny had a while ago, but I think it's just to reinforce the point that the geographic location of households, as well as their livelihoods, is an important dimension to consider. And though Kenya is urbanizing, a majority of Kenya's population still lives in rural areas with higher concentrations of vulnerable segments, both in terms of income as well as in terms of age. So you have more elderly and young children in rural areas than in urban areas. And so that's all I wanted to point out here. We can, I don't know if there's any questions on what I've just gone through.
Paul, I mean, just for some questions coming in, there's one from Victor Nkiri who says, for casual workers, what is the average pay per day? That's not something you presented, but in Kenya, any sense of, from your years of working there, what that entails?
Oh, that's a really good question. I don't have a good sense of what the average income is. Unfortunately, it's something that I could have gotten, but I don't have it on hand. But I'm happy to follow up, and I can share the data with a respondent shortly.
All right, great. Then there's a question: what does ASAL mean?
Yeah, so ASAL is arid and semi-arid lands. So there's about 29 counties in Kenya with this designation. So in general, these are lower density in terms of population, lower population density areas that have low potential for crop production because of low average annual rainfall. I can't remember what the specific threshold is. But here on this chart, you're seeing that, so 50% of Kenya's poorest, so among the poorest 40% of Kenya's population, 50% live in rural, arid and semi-arid lands. So these are counties in the north of Kenya that are generally more pastoralist and have much more vulnerable livelihoods. But at the same time, they're also going to be less likely to be impacted immediately by the epidemic because they are more isolated and can draw on livestock to at least maintain some subsistence level of consumption.
All right, thanks.
Yeah.
Just to say, I just had a note from Amolo. She will hopefully be able to join us shortly. Right, that area called Transfer Me. Beth, can you hear me? If you just unmute.
I can hear you.
Great, thanks.
Did you ask a question to me?
Yeah, I mean, there was a question about what do we mean by transfers, the purple shaded area?
Oh, yes, that was just, I think it was explained. It's remittances, people receiving government pensions or other forms of welfare. Anybody who is receiving income that they are not generating themselves.
All right, thank you very much. Sarah, can I just ask you, Amona says she's on the call, but if you could just send the panelist link to her that she can join us for the full panel, I think that would be useful. Thank you.
She's on as a panelist, Henny.
Henny, I'm actually here.
Oh, fantastic. I just can't see you. Amola, great. Thanks for joining us. Let's go back to your slides then. So Sarah, if you can go back to slide number 10. Some rapid research to find out how this is already meeting, the COVID-19 pandemic is already meeting the financial conditions of respondents. So Amolo, while Sarah is sharing the screen and coming up, welcome. And perhaps you could just tell us quickly on how you did the survey.
Yes, so it's an online survey. It's a SurveyMonkey panel. And this is a panel they maintain that anybody can sign up and ask questions of a paid group of respondents. So to that extent, it is not representative of any particular population other than SurveyMonkey panelists, but they do have a segmentation by income. So in each of the countries that we did this survey, these are low income people and lower middle income people. And we covered the 7 countries, as you can see. In Africa, there's Kenya, Nigeria, South Africa at the bottom, also India, Mexico, the UK, GBR at the top, and the USA. And so the main benefit of this survey is it's extremely rapid. So this was sent out on March 25th, which is, I guess, almost 2 weeks ago, and we had results by the 27th. And so it's indicative and raises questions more than I would say provides answers. But we will be repeating it, and we hope that the fact that it's so rapid allows us to at least raise questions that maybe other more detailed research methodologies can study in more depth. And then just the other point about that, I think, is that everyone in the world, we're all reporting from home, so it's more representative of the experience than maybe in some other cases where you ask, you know, college students, and they would not have commonalities in their life, but this instant is more full of commonality than many others. So I think for me, what was actually shocking in this first slide is just that at that moment, there had not yet been a lockdown in Mexico or in South Africa or in major cities in Nigeria, and in Kenya, there had not yet been a curfew, although there had been some social distancing measures. Yet we see that already most respondents in all the countries have said that their income has been affected, and Kenya particularly high level of effect of significant decrease in income. Next slide, please. And I think, Paul, I came in at the end of what you were saying, which was that few adults have money put aside. And this was very much reflected in our study. This is, you can see the red is people who have no emergency funds put aside. Very high. So these are low and low income, lower middle and low income respondents. And you can see that in the African countries, and actually around the world, except in India, where half of people have no money put aside, but most people actually have no money put aside. And the gray bar is also a worrisome bar, because that's the group of people who have funds put aside but have already tapped it. So you can see that even when people do have money put aside, the preparation for the emergency, because remember, these lockdown measures had mostly not happened yet, but the preparation for the emergency had already caused them to tap on their savings. Next slide. And well, not surprisingly, most people think that the COVID-19 will affect their financial well-being. And this is less true in Nigeria. I'm not sure why, but more so in Kenya and South Africa. Next slide. So just a comment on the previous slide, people felt it would affect their financial well-being. We also asked them, would it affect your health? And they were much less worried about their health than they were about the financial effects. And certainly in African countries, there's been very little health effect up to now, whereas as we've just seen, the financial effects have been quite severe. So there was a subset of our survey who were in business, and you can see that the average weeks that business can continue from their available resources, what they thought is roughly a month. And the highlight shows that of that month, we're already eating into 10 days, getting on for 2 weeks. And we expect that the lockdown and restrictions and economic decline are going to continue for more than the month, which on average businesses expected to be able to survive. So I think it is quite worrisome that both individuals and businesses are drawing down on their savings. They do have a stock, and we saw that individuals have stocked up in advance of the lockdown measures, but the amount of time that they can survive is actually considerably less than the expected length of the economic downturn. So it is quite worrisome in terms of how are these businesses going to maintain themselves in some kind of suspended animation? How are they going to maintain their staff? And how are they going to recover when they come back? In many countries, they've been told, don't pay rent, don't pay utilities, don't pay, well, they have not been paying staff, they have to bring them back. But they're going to come back with a backlog of things that have to be paid for, and they'll have drawn down their resources. We didn't see them drawing yet very much on their credit, but naturally they would tend to start to draw on their credit, and sources of credit have also started to tighten up. And so I think this slide is quite worrisome in terms of how long will the restrictions last and how will businesses recover from that. Next slide, please. Okay, I think that brings me to the end of my short rapid dipstick result.
Amora, thank you very, very much. Just a quick question. I know that we put in here, but any indication from your survey on the extent to which people can draw on credit to respond to the current situation in which they find themselves?
So we did not ask what is your available credit. We asked what resources did you use to stock up the stock. So people had stocked up on average, I think, about a week. And we asked, where did you get the money to stock up? So savings in every country was way far and away the most largest source of funding for how they have stocked up. The other sources of stocking were not purchasing something else, also friends and family, and in some cases informal sector, especially for women. But we did not see credit as a major source of stocking up. And anecdotally, what we've heard in Kenya is that some people have paid off their digital loans. Most of the digital loans you can't borrow again until you've drawn your credit down to zero. So they paid off so as to have credit in a future difficult time that they anticipate. And yet the digital lenders are also stepping back, and at that moment when they're going to need it, probably quite soon in the future, that credit may not be available for them. So right now people don't seem to have drawn very much on different sources of credit, but it's a concern for the fairly near future.
Right. Amora, thank you for that. In terms of structuring our discussion on what is to be done, before we get to the slides, the last one on the policy direction, perhaps just if we can go back, Sarah, and if you would be so kind as to put for us slide number 8 on the screen, because that's really where we have some sense of the scale of the problem. And I'd be really keen for you, Beth, to come in. So looking at I think it's further back. Yes, Sarah, you'll find it. Looking at this slide, it's interesting to me that if you look at countries like, and this was from the Gallup poll, Kenya, Vietnam, Greece, Chile, Colombia, Bangladesh, that you have virtually all of them. People say that after 4 weeks, nearly 50% of adults will not be able to cover their basic needs. Now that's a, yes, this is it. Thank you, Sarah. I mean, and if that is a really optimistic scenario, would it be safe to say that in these countries, as well as the low-income countries that we've looked at, we are either already, if they have comprehensive lockdown measures, we either already or will shortly be in a position where almost 50% of households in these countries cannot meet their basic needs. Beth, would that be a fair assumption?
Yes, I mean, it's fair assumption based directly on the data, based directly on the responses that people gave to these questions. Now, what we don't know is how accurate people are in actually answering these questions. You know, there's a big subjective element when people are asked something like that. It's a hypothetical. And so we don't know whether people interpret the word survive the same way, or make ends meet, or cover basic needs. There's many, many uncertainties about the way that the question is asked and answered. But I think you can definitely see that the scale is enormous. Even under a very sort of loose interpretation, you would, or allowing for a difference between responses and reality, even under the best of those scenarios, you would see a huge drop-off already starting to happen. The number of people in these surveys that, in the Gallup surveys, that said 1 week was actually surprisingly high.
Amazing. Yes, you're quite right. You're quite right. Paul, I mean, just turning to you, I mean, you've almost had, I won't say a lifetime, but many, many years of experience analyzing Kenya. I mean, 3 weeks into lockdown, I know in South Africa, where I sit, it's a 3-week period. It may be extended. I mean, what's likely to be the case 3 weeks into lockdown in Kenya? I mean, what percentage of the population do you think would have serious difficulties meeting their most basic needs then?
I think I might invoke some humility and say that it's very hard to predict what's going to happen, other than to say that at least in a 3-week time frame, assuming that access to food markets isn't shut down, and people involved in the agricultural production, which is a significant share of Kenya's poorest income segments, if they can continue to earn some money by selling to markets, if people like mama mbogas who sell vegetables and fruits, if they can continue that activity and earn some money, then that it might not be as dire as one might predict, but that would require adapting some of those activities so that they can be safe. So people in markets, making sure there's social distancing, hygiene, so expanding infrastructure, hand washing infrastructure, usage of masks. So if those activities, if the food supply can be protected, then it might not be so bad. But I think for people lower skilled work and services, which again is also a significant chunk of livelihoods in Kenya. So people in retail, restaurants, tourism, hotels. I think 3 weeks, already you're going to be seeing those people really struggling. So that's my best attempt at answering that difficult question.
Thanks, Paul. No, it's fair. Yes, Beth.
Just on this, just how quickly the fall off happens. Just one little piece of anecdotal evidence from my neighborhood, which is a very well-off neighborhood in the United States. The food banks that are here are already, after 3 weeks of lockdown, they're already seeing a huge spike in requests. It's doubling from what the normal set of requests for food assistance is. So the drop-off is very quick.
Well, I chat, if you could go to the first slide in Paul's section, it's slide 15. It says, how do financially resilient individuals access emergency funds in Kenya and around the world? And I think the question I'm keen to come to here is, I mean, if we look at the light yellow at the bottom, those are obviously savings. And I think a safe assumption would be that most people will not be able to save at the moment. Then we've actually got a very small band of credit above that for just about all countries except North America, where it's 1 in 10 that would turn to credit. And I think given this, and I think Beth made a point yesterday or earlier when we discussed this, that the financial sector has a critical role in the reticulation of funds. What is the role of the financial sector after savings have been exhausted to really provide other value for people to access in this time? And it would seem to me, given this, that there's actually a huge reticulation role for the financial sector, but very little of a credit role. Would that be a fair assumption? Amola, I think you've been looking at this as well. What would your view be?
Well, I think this has to be a time for credit. People will draw down their savings, and yet they will need money. Well, they will need money to live in the short run, which I think is a time for government and for social transfers. Right. And then the economy has to get going again. And I think that getting going again is going to be very important role for the financial sector to come in, probably with products that are different and better than the ones that they have been having up to now, especially for small and even larger businesses, to allow the economy to get going again. Because both for businesses and individuals, if you've drawn down your savings and you've drawn down your kind of traditional sources of credit, you will need new sources of credit to get going again. And the financial sector will have a very important role to play, I think.
Right, right. Well, just while we're on that, so if the financial sector is to provide new credit, well, what is your sense on how government should go about existing credit? Is it a time for, I mean, everywhere there's really reduced interest rates. Should we be speaking about extended repayment holidays? What's your sense, Amola?
Well, the Kenya government has already told the banking sector that people don't need to repay their loans for at least a year. Then right. I think they backed off some of that to 3 months, or some of the banks have offered people a 3-month holiday. And I know that that's true actually in many countries. Even in the US, student loans, federal student loans have a 90-day, I think, repayment moratorium. So I think it's necessary in the short run, and people simply can't pay, and turning them into kind of bad credit cases is not helping. But I think it does present a real conundrum for how do we allow that recovery period to take place, because the people who are coming back into work, or the businesses that are coming back into business, they will have this credit overhang. They'll have their rent they haven't paid, the utilities they haven't paid.
Yes.
And I think we are going to need to supplement the traditional existing sources of credit with new sources of credit, and government may need to be involved in some of, or likely will need to be involved in some of that.
Right, thanks. Beth, coming to you, you know, the financial sector has a role to play. I think that's what Amola is saying. Your view on, you know, and having looked at financial health intensively, your view on the role of the government and the private sector at this time. You've mentioned the community food banks, interesting, they've got a role to play, as all communities do around the world. Your view on where the government and the private sector should come in at this time?
Well, I think it's, yeah, I think it's clear that the government has to step in. It's an unprecedented, unprecedented. Financial sectors are good at dealing with idiosyncratic risk and not good at dealing with systematic risk. That's been the government's role, is to step in when there is systematic risk. When I think about this, and look at the disparities between the higher income and lower income countries, I also think this is a huge income distribution issue. Certainly the rich world needs to support the less affluent parts of the world. You know, I know the World Bank is trying to gear up as fast as it can to approve projects government by government. I know they're planning 150 billion to spend about 150 billion over the next year in support to governments. I don't know if that's enough, but I know that the international community needs to spring into action in that way.
Mm-hmm. Thanks, Beth. Maha Khan has just told us that a 21-day lockdown in Nairobi has just been announced, effective at 7 p.m. today. So it was worrisome what will happen to low-income populations. Thanks, Maha, for that information. Then there's another comment here from William Diaz Alvarado, says, I agree that governments will be the ones that will cover the supply of credit for some time. Check the case of Peru. Any of our panelists know something about what's happening in Peru? No, not yet. Right, thanks. But I wonder what African governments will be able to do. And Beth, I think that's where you come in. If you look at a number of the countries in Africa, they've got really fiscal challenges. That, I think, is where your suggestion is that we would bring in some additional resources from the international community.
Yes. I can't see it. I can't see them. I can't see the resources being materialized elsewhere. I do have one other thing that's sort of at the opposite end of the spectrum, which is how the lockdowns are done. You know, are they done? And I don't, you know, certainly not a health expert, so I don't know how much leeway there is, but it seems that the lockdowns are being done in a very blunt way that doesn't make allowances or for the fact that there are some things that people can be doing to mitigate their economic problems, but such as enabling restaurants to be operable using grab-and-go delivery services, or enabling savings groups to meet, you know, sitting 6 feet apart from each other. Some of the kinds of restrictions that that are being made are such blanket restrictions that you know, just a small tweaking might be able to help support a little bit of economic activity in a way that would not be especially dangerous.
Yeah. Thanks, Beth. Paul, I want to turn to you now. I think it would be safe to assume that governments, particularly in Africa with very restricted fiscal envelopes, really want to tailor the emergency relief to the households that really need it. How can they do that? Because as we see, you know, some households, particularly in rural areas, may be able to support themselves better than in urban areas. What should they be measuring to do that? If you put out a survey out there, what's the best way of finding out what the solution is and how to target this, given what you have studied?
Well, I would say, so on one hand, Kenya has some strengths here because it already has 3 or 4 established cash transfer programs which support you know, Kenya's most vulnerable. However, their current targeting is in, you know, in northern counties, which are, you know, the have the highest poverty rates, but also in the short run, the least likely to be affected additionally by the epidemic. And they have cash transfer programs that target orphans, families with orphans and with elderly. And I think the Kenyan government has already committed to ramping or expanding those. Where it's perhaps where there is a gap, I think, is with vulnerable segments of Kenya's population living in towns and cities who are earning maybe just a little bit above the poverty threshold, who aren't getting much official support at the moment. So I think in the short term, I would focus on trying to target resources to vulnerable households and individuals in urban settings who are earning at not well, obviously who are poor, but also who are likely to be poor or going in facing hunger and severe shortages of food and other basic necessities in towns and cities. And I think probably there is where we need to be a bit creative with targeting and sort of a little bit outside of the scope of the current cash transfer programs that Kenya has in place. Yeah.
Can I just add to that kind of targeting is something that financial institutions are also starting to do and needing to do, to be able to analyze the different effects, differentiated effects among their clients.
So I wanted to, I think, pick up a little on what Paul said and say...
Expand a little bit on that.
Sorry, were you asking me?
Yeah, no, please continue with your input.
Yeah, so I was saying, I think richer people or less poor people are huge supporters of poorer people in most of the, I think in Paul's slide, it showed in most countries really. And with wealthier people losing their jobs and people in the city no longer sending money to the rural areas, I completely support Paul's point that a much wider scope of the broad population really needs to be the subject of some type of transfer, because not only poor people are dependent on transfers anyway, but they're losing some of the transfer from wealthier people who themselves can't support themselves any further. So I think I mean, obviously there isn't infinite money, and that's one of the reasons why people want to target, but the people who need transfers now is probably 2/3 of the population, and not the 5 or 10% who are covered in the Kenyan example by existing transfer programs.
Yeah, just a build on that. I mean, I think Kenya faces two related problems, and the one is sort of how to keep its kind of high growth, high value add sectors and economic engines intact. These are the sectors that provide high wages, give Kenya a competitive edge, and those high wages in turn support lower income segments, not only through remittances but through demand, right? Demand for services, and so that's one challenge, I think. And the other one is protecting this large group of informal employment who don't have much recourse or ability to access unemployment insurance or protections from other worker benefits. So I think those problems are related, and so I agree with Amolo that I think it needs to be an expansive set of support, not just for I guess the most vulnerable, but also for individuals who through transfers and remittances are supporting lower income segments as well. And you also don't want to see dynamic and high growth sectors lose its capabilities. You want those sectors to bounce back quickly as well, so that the Kenya's economic engines can continue to pull the country forward, not just in the next year, but in the next many, many years to come.
I would just want to add that in all of these efforts, given what we've seen in terms of how long people's resources last, whatever is done needs to be done quickly. And so that probably means, you know, being less bureaucratic about eligibility criteria and processes to go through to qualify than normal.
Oh, just coming back to
Sorry, my connection's a bit, I don't know if that was a question directed to me, Henny, but.
I couldn't hear Henny either.
I think we lost you for a moment there, Henny. I think your internet may have paused you out for a while. Perhaps you could repeat your question.
Thank you very much. Can you hear me now?
Yes.
Great. Right. So my question is this. Given the fact, firstly, that countries with existing social transfer systems already have a reticulation system that provides some minimum form of income, given the urgency of the crisis, and I think Amola's very good input about the reticulation that's already happening, isn't the best answer to be able to people who are not getting welfare payments, the best form of income as widely spread as possible as can be done? In other words, reticulate as widely as possible. This is similar to what the UK, for example, has done. And to the extent that countries can muster this, to go as far down that road as they can. Isn't that the most reasonable response, rather than to worry too much about targeting, given the speed of the response required?
I think so.
Yeah.
Yeah, I wouldn't.
Does everybody understand the word reticulation? That's like not clear to me that people know what you're talking about.
So sorry, Beth, what I mean by that is getting the money to the people. In other words, you know, with social transfers, you've got individual recipients and you use a financial system to pay the money to them. So what I mean by reticulation is just getting the money to the people, transferring it, spreading it through the population. Is that clear?
Yes, and I mean, this is such an opportunity for increasing digital participation and such a necessity to increase the digital participation right now.
Mona, you were going to give a further response?
No, I don't think so. I think I completely support the idea that government should do their best. I think there was a question in the comments about, well, how do they afford it? Which I'm not really qualified to answer, but I think that most of the governments are looking at a variety of rearranging their internal budget and seeking, you know, support from donors and other, and calling on private donations is one of the things the Kenya government is trying, as well as cutting salaries of senior officials. So I think governments are trying a wide variety of ways, but I feel like the payment of these income support payments should be really a #1 priority and crossing a very wide range of the population.
Thanks. Just a few questions before we start wrapping up. In the panel's opinion, do you think that the lack of resilience for households are currently experiencing and will soon experience more could change savings behavior significantly in the future? If so, how could this increased awareness of the need to save be leveraged best to create stronger resilience? Beth, do you want to respond to that?
Yeah, I mean, I think clearly it's a lesson learned that people need emergency savings. I think it's going to put emergency savings much more on the policy, in policymakers' minds. You have something in the UK, the Money and Pensions System, which really is a government agency responding to the concept of financial health, and it strongly emphasizes emergency savings. So I think that kind of initiative is going to come up more as a result of this. How well that changes behavior, I'm not sure. I think, you know, individuals will have learned their lesson. Those kinds of lessons tend to fade over time. And it may be that savings, you know, some chunk of the shortage of savings is because people just haven't been able to save, not because they haven't intended to save.
Right.
So
right.
I think, yes, it will have an effect. I would say the lasting effect is more likely to be on policy than on individual behavior. That's a guess, of course.
Got it. Thanks. How should smaller donors, this is from Timothy Hobden, smaller donors whose resources cannot provide large-scale social cash transfers, be responding to the crisis? Paul, do you want to venture an answer there?
The question was, how should small donors be leveraging?
Exactly, be responding to the crisis, because their resources aren't big enough to do large social transfers. So what could they be doing in the current circumstances?
I think possibly funding research could be, you know, be particularly valuable at this moment. There are low-cost ways of, you know, one of the important dimensions of the policy response here is going to be making sure the populations get appropriate messaging to support behavior change. You know, so, you know, think about all the behaviors that people are going to need to start doing more: hand washing, you know, changing how they greet, potentially wearing masks, letting people know about assistance available to them. And so digital messaging is one way to do that in a fairly low cost way. So maybe doing some experiments or research around ways, you know, to message about the virus, ways to protect yourself, protect your family, ways to conduct economic activity safely. Getting people to adopt some of these positive behaviors, I think, is one potential avenue that small donors can look at.
Thank you. Any other contributions from the panel on that?
I think I would add that the recovery, we are all very focused on the cash transfers, and it's absolutely important in the short term. But I think the recovery phase is going to involve a wide range of challenges, some of which we don't know what they are, and some of which we've just been discussing in terms of getting credit to microenterprise. And I think there's a lot of preparation for that phase and early interaction and possibly pilots that smaller donors could be involved in. And just for example, how do we know what an informal enterprise is and what its employment status and capital stock is? And do we have a way to answer that and subsequently perhaps to target programs towards them? So I think there's a lot of scope for creative thinking, although the cash transfer is the short-term emergency need, that the recovery phase is going to demand a lot of creative thinking, pilots, and larger scale efforts to get things going again.
If I could just add on that, I think this is a classic time for the use of loan guarantees. This at the time when the recovery starts to happen. So you want to use loan guarantees at times when the market is overly risk averse based on sort of a realistic judgment of risk. And this is likely to be a time when governments and foundations are more able to be supportive of a quick start back up or restart based on loan guarantees that incentivize financial institutions to go ahead and take the risks that may not look quite good enough to them at the moment.
Right. Thanks, Beth. Well, I'm going to do a quick summary, and then we're just going to go around the panel before we close. I think we've answered most of our questions as well, and thank you to those who have posed questions. It seemed to me that in the short run, where we're coming up with is that we have a global population, and particularly in sub-Saharan Africa, which is really extremely vulnerable. And the way in which the lockdown has been implemented in the countries that have already gone that way, it also removes much of the ability of people in the informal sector to continue their livelihood. And that means that we could have anything up to 50% or more of households that could really be struggling to meet their basic needs in the next few weeks. And to support that, I think what our panel has come up with, and I think our audience supports that, is to spread the available income, and we really need in Africa, both the private sector and the international community to support that, to spread the income as widely as possible at the moment, since we probably won't have the luxury of targeting it much further. And I think Beth's suggestion there of a careful consideration of lockdown procedures to be able to at least safeguard some income is an important part of that. The financial sector also can play a role in getting the money to the people that should be receiving it. And then I think we've had a stream of comments from the panel that say we should also be considering the recovery phase. It's going to be quite difficult. And that would include measures not only to delay debt, maybe even to write off some debt, but certainly also to implement guarantees and other measures that help small businesses to access credit when there's going to be very little around and where they would certainly not qualify using traditional means. I think that's the shorter term and the longer term responses that we've heard. But let's just close. Beth, do you want to kick off on final comments, please?
Yeah, I mean, we started with financial health, and I think this is a big object lesson in financial health. And if this doesn't, if this experience doesn't change the way policymakers look at financial health in the future and recognize that part of their job is to pay attention to how financially healthy people are and to support whatever they can to help people achieve financial health, I think this could be a long-lasting shift in the way policymakers think about that.
Thanks, Beth. Paul?
Yeah, a couple of thoughts. I mean, I think the playbook for how to contain this pandemic at a country level has been sort of written by high-income countries in Asia, Europe, and the US, and there's been a mixed experience. There's been lockdowns. There's been sort of a herd immunity, so kind of do nothing approach. There's been lockdowns without a lot of income support. There's been lockdowns with income support. And I'm not sure, and of course there's been widespread testing and tracing and containment that way, like South Korea and Germany. And I'm just not sure any of those playbooks, so I think lower income countries and in Africa in particular are gonna have to be especially creative in stitching together a response and putting together a playbook, but we don't have kind of the right model yet, because it's a lot of those strategies that are being applied in high income countries are less feasible in lower income countries. So I think there's an opportunity now there's a need to act quickly, and I think lockdown plus income support is probably the way to go, but lockdown with in a way that doesn't completely shut people off from opportunities to earn income. And so how can governments explore ways and experiment with ways, not only governments, but communities and governments supporting that bottom-up response to conduct economic activity safely where possible, adapting the way we transact, using digital channels more. So I think there's a lot of room for innovation there. I'm worried about the situation where, very strict lockdown, which leads to, hunger and starvation at one extreme. So there has to be, I think, an intermediate response. And I really hope from this is that governments really think of financial resilience as a policy objective and financial health as a policy objective, and begin to think about it in a holistic manner. Not only actions that the financial sector can do to encourage savings, for example, but also, a renewed focus on strengthening social safety nets, and including health financing, which, even without a pandemic, health shocks are a big part of life in low-income countries, and people are particularly ill-equipped to deal with them. So those are my thoughts.
Thanks, Paul. Amolo.
I think Beth and Paul said most of what I was going to say. I think I would just try and add a note of hope at the end, which is just some of the survey results we've been seeing from our colleagues, the China Academy for Financial Inclusion in China. And they have passed through the major phase of the pandemic and are now in the recovery phase, and all is not going smoothly, and their micro enterprises have been very starved of capital. But I think they have seen that the micro enterprise sector is very resilient, and that, as I had mentioned earlier, digital lenders have come in substantially to support the growth or the recovery. And I think just to support the 2 points, that we need to do things in a way that fits our circumstances, and we have better digital tools than some of the high-income countries. And we need to keep financial health not only of the individuals, but also of the businesses and the institutions that support them as important policy goals. So I'm optimistic that we have the tools, and we have the minds, and we have a recent history of quite a bit of creativity, and that if we all put our minds together, we actually will be able to come up with solutions that allow us to live through and recover from this.
Thanks, Amolo. Well, it seems there are 3 points. Once financial health and resilience matters, and governments need to pay a lot more attention to it. The second one from Paul, and I think Beth also alluded to it earlier, we need an Africa lockdown model, and we need a little bit more creativity on how we do that. And from Amolo, I think, Amolo, if I can paraphrase, and I'll watch your face to see whether I got it wrong, Africa's probably much better placed than 10 years ago to get tools to help us recover. We've got very good digital payments networks that can be well used. And if anything, we've got a very resilient population. Perhaps the fact that it's rural and informal could be a benefit in this time as we go for recovery. Well, on that hopeful note, thank you very much to our 3 panelists for joining us and for great contributions. Sarah, thank you very much for managing us effectively. To all of you, have a good day or a good evening, depending on where in the world you are. And when all of this is done, let's pay a lot of attention to our personal financial health. Good day.
Stay well, everyone.
Thank you very much for the opportunity.
Bye.
Bye.